Today we will talk about the nephrogenic diabetes insipidus. Here the nephrogenic means kidney, and diabetic insipidus, that is a disorder when there is imbalance of fluid in the body. Normally, as we know that in normal blood vessel, this is the blood vessel, and it contains fluids plus solutes, means solvents and solutes. These solutes may be sodium, magnesium, calcium, or other substances, and the fluids may contain the water or plasma. These substances produces normally a pressure in these blood vessels, which are known as osmolality. And the normal osmolality of these fluids in the blood is around about 300 milli osmol, 300 millismol per liter. When this osmolar pressure increase in this blood vessel, it sends a message to the hypothalamus, and in turn this hypothalamus provide message to the posterior pituitary gland. This pituitary gland, when stimulated, they produce a hormone which are known as antidiuretic hormone. This antidiuretic hormone will act on the distal convoluted tubule and will cause the reabsorption of water into this blood vessel, and as a result the osmolality of this fluid and the fluids in these blood vessels will becomes normal, that is 300 millismol per liter. It means this is the normal range of the osmolar in these blood vessels. But sometime this distal convoluted tubule of the kidney do not respond to these ADH hormone. This ADH hormone, and as a result more amount of water moves through the urine. It means the urine becomes more diluted, and the fluid that are present in these blood vessels become more concentrated. So when the kidney do not respond to this ADH, there is produce a condition which is known as nephrogenic diabetes insipidus. It means when the disorder, the imbalance of fluid in these blood vessels occur due to the no-response of the kidney to this ADH. So the fluids imbalance occur in these blood vessels. This condition is known as nephrogenic diabetes insipidus. And as a result, what will be the symptoms of this diabetes, nephrogenic diabetes insipidus? Due to more loss of water, there will be the dehydration of the body. Dehydration of the body. It means the body will be more dehydrated, and the body will also becomes more thirsty. Means the body will requires more water. So the persons will drink more water. The other symptom of this nephrogenic diabetes insipidus is that there will be increased amount, means concentrated amount of nutrients in the body, which are known as hypernatremia. Hypernatremia means high amount of electrolytes in these blood vessel, and these electrolytes may be sodium, magnesium, calcium, potassium, and these more amount of nutrients, electrolytes in these blood vessels will cause different disorders in the body, such as confusion, seizure, or other brain or heart conditions. So the treatment involved in these conditions include thiazide diuretics. The mechanism of action of thiazide diuretics is that when the kidney filter the fluids into the body, some of the substances are reabsorbed, important substances are reabsorbed through the proximal convoluted tubule, loop of Henle, or distal convoluted tubule. In the distal convoluted tubule, normally the sodium and chlorine are reabsorbed into the blood vessel to maintain the volume of the body. But these thiazide diuretics, by acting on these sodium and chlorine receptor, as to block the reabsorption of the sodium and chlorine into these blood vessels. As a result, the volume of the blood becomes reduced. Volume of blood or fluid become reduced in these blood vessel. As a result, the flow of the fluid towards the kidney is reduced. And that's why the kidney will not filter more water, and as a result the water will not be in the urine, so the osmolality of the fluid in these blood vessels will become not disturbed, and it will be normal at 300 osmolar. The other medicines that used in the treatment of nephrogenic diabetes insipidus includes NSAIDs, that is ibuprofen. Ibuprofen also helps to reduce the volume further when they are used in combination with these thiazide diuretics. So these two medicines are normally used to treat this nephrogenic diabetes insipidus. That is all about the nephrogenic diabetes insipidus. Thank you.